Monitoring the CEA levels isn't your go-to test for finding colon cancer, it's your go-to test for following up after you've already found and treated it. The tumor marker CEA doesn't help you diagnose or stage the cancer, but it does become helpful after surgical resection. So if a patient's CEA does not drop post-op and it starts rising again, then that's an early sign to look for residual and recurrent disease. So we'll look at this particular case. We have a 63-year-old man undergoing colectomy for stage 2 adenocarcinoma of the ascending colon. His pre-op is 9 and his post-op is 8.5. So what's the next step? Order imaging to evaluate a residual recurrent disease. So the CA should normalize after complete resection, and the fact that it isn't is a little bit worrying, and so that's why we do that test. It's not going to be used for screening. It's got low sensitivity and specificity, and oftentimes if there is surgical, if there's like a circumferential mass, then surgery is going to be indicated regardless of these CEA levels. And you're not using it to determine the type of chemotherapy because adjuvant chemotherapy is recommended for node-positive colorectal cancer regardless of the CEA levels as well. Grading and staging. So the tumor grade is based on a histological examination, not the CEA levels, and the staging is going to be the extent of the spread, and it's not determined by CEA levels. And so it's not going to be involved in staging it or grading it. You're just going to be monitoring for residual diseases. And so, yeah, elevated CA would tell you there's a worse prognosis. And that's pretty much all there is for this particular question, just knowing why we use the CEA. And it's that we can monitor for residual diseases after we've already done something about it. So CEA is a glycoprotein produced in fetal GI tissues. It's really expressed in some cancers, especially colorectal, pancreatic, gastric, and breast. And it's increased in smokers, not useful for screening or initial diagnosis because of its low specificity, so we use it for disease. All right, we'll see you guys in the next video.